We'll be discussing regarding acute diarrhea in a 2-year-old child. So, what is an acute diarrhea? It is greater than or equal to 3 low stools or watery stools within 24 hours, less than 14 days. It is a major cause of under 5 mortality as well as morbidity. Close to 500,000 children die annually worldwide because of diarrhea. And in India, it is a persistent burden despite interventions. So, the difference between diarrhea and dysentery is quite important. So in case of diarrhea, there will be greater than or equal to 3 watery stools per day, but no blood. Whereas in case of dysentery, diarrhea with blood or mucus, usually this is caused by Shigella or Enterovirus. The common etiological causes include rotavirus, norovirus, adenovirus, or astrovirus. In bacteria, E. coli, Shigella, Vibrio cholerae, Salmonella, or Campylobacter. Whereas in case of parasitic, it will be Giardia, Entamoeba, or Cryptosporidium. Sometimes it can happen due to non-infectious causes like food poisoning or antibiotic associated diarrhea. So now coming to the epidemiological factor, the host factor. Children within 6 months to 2 years of age are at a higher risk, and malnourished children, lack of exclusive breastfeeding, and incomplete immunization. And children less than 6 months are protected if they are given exclusive breastfeeding. Coming to the agent, rotavirus is the most common agent, followed by Shigella and Vibrio cholerae. In case of watery diarrhea, dysentery and epidemic. Unsafe water, poor sanitation, and seasonal variation are also causes. Poverty, illiteracy, and poor healthcare access results in diarrhea. So symptoms include frequent watery stools, vomiting in case of viral, fever in case of bacterial, abdominal cramps and irritability, followed by poor feeding and lethargy. So the signs include there will be sunken eyes and dry mucosa, reduced tears, delayed skin pinch. In case of some dehydration, there will be restlessness and increased thirst. Severe dehydration, there will be lethargy and shock. So, in case of history taking, you should remember, you should ask about the onset, duration, frequency, nature of the stools, followed by associated symptoms like fever, vomiting, abdominal pain, and breastfeeding practices and bottle feeding practices, and what are the things they given during weaning. And exposure to unsafe water or sick contacts. Then, past episodes of such diarrhea, drug use, and immunization status has to be carefully elicited, and hydration status has to be checked. So, diarrhea causes dehydration, and dehydration can be classified into 3 types: no dehydration, some dehydration, and severe dehydration. So in case of no dehydration, the child will be alert and normal, and it will be feeding, and it can be managed on outpatient basis. In case of some dehydration, there will be restlessness, sunken eyes, and thirsty. This child has to be observed, and the child's parents should be taught regarding warning signs of dehydration, warning signs, and has to be given ORS. Then they also has to be taught about the impending warning signs and referral system. WHO Plan A is for no dehydration. So the child will be asked for continuous feeding. Home fluids can be encouraged to take, followed by ORS after each stool. So how to prepare ORS? ORS has to be prepared by taking 1 liter of water, then boil the water. After boiling the water, mix it with ORS. So each ORS has to be used within 24 hours of preparation. And in case of child less than 2 years, they have to be given 50 to 100 ml. For child 2 to 10 years, they have to be given 100 to 2 ml of ORS water after each episode of stool. And you have to educate the mother regarding danger signs, which include sunken eyes, dry tongue, lethargy, reduced thirst with loss of consciousness. Now, plan B. This is for some dehydration where ORS of 75 ml per kg body weight is given for 4 hours. Reaccessing has to be done after every 4 hours, and we can shift to plan A if improved. If plan A, if it is not improving, then they have to shift to Plan C if condition worsens. So what is Plan C? So this is for severe dehydration. So IV ringer lactate solution is preferred, though NS also can be given. For children less than 12 months, 30 ml per kg in the first 1 hour, and then 70 ml kg for 5 hours. In case of child with 12 months to 5 years, 30 ml kg in 30 minutes, and then 70 ml per kg for 12.5 hours. If IV is not possible, ORS can be given via NG tube or spoon. So, if you could remember, this has to be doubled up in case of children between 1 year to 5 years of age. So, the other treatment measures include zinc supplementation in syrup form for children less than 6 months, 10 mg per kg. For more than 6 months, 20 mg per kg for 14 days. And they are supposed to continue breastfeeding, and age appropriate diet can be given. Antibiotics only if dysentery or cholera or any systemic infection is suspected. Hospitalization only in severe dehydration and shock. Then IMNC program, that is integrated management of neonatal and childhood illness, and systemic classification of no, some and severe dehydration. Emphasis on ORS, zinc and continuous feeding, counseling mothers and referrals for severe cases. So coming to immunization, rotavirus prevents severe diarrhea, measles prevents measles related diarrhea, which is available as measles vaccine, MR vaccine, MMR vaccine, and even MMRV vaccine in private sector. Cholera vaccine is indicated only in endemic outbreaks. A typhoid conjugate vaccine can also prevent enteric fever. So the probable causes of diarrhea include this vicious cycle of improper weaning, bottle feeding, or incomplete immunization resulting in rotavirus, E. coli, or Shigella giardia infection. And in environment, there will be unsafe water sanitation issue resulting in malnutrition, micronutrition deficiency. Again, this becomes a vicious cycle. So acute diarrhea is preventable and treatable. ORS plus zinc plus continuous feeding is the cornerstone stone of management. WHO Plan A, B, C ensure proper fluid therapy. National programs are there, including IMNCA, that strengthen the control of diarrhea outbreak. Safe water, sanitation, and immunization reduces the burden of diarrhea. Diarrheal deaths are preventable with public health action. So, hope you have learned through this. Thank you.